Welcome back to the MedHeads podcast, your go-to source for breaking down the latest health research in a way that actually makes sense. Today, we're diving into the fascinating world of two underappreciated vitamins, vitamin K2 and vitamin D3. Sure, you've probably heard about vitamin D for bone health and maybe even vitamin K for blood clotting. But did you know these two nutrients work together in ways that could impact everything from your heart health to immune function to even COVID-19 recovery? We'll unpack the latest research on how K2 and D3 affect bone strength, cardiovascular health, metabolic conditions, their potential role in severe COVID-19 cases, and how they may help during recovery. Plus, we'll clear up the confusion on whether supplements are really necessary, or if you can get what you need from diet and sunlight alone. Let's get started. We've long known about vitamin K1, the form found in leafy greens, and its role in blood clotting. But vitamin K2, menaquinone, is where things get really interesting. K2 is crucial for calcium regulation. It helps ensure calcium goes into your bones and teeth rather than clogging up your arteries. A recent review highlighted that vitamin K2 might be a game changer in bone health. In fact, it could be as effective as bisphosphonates, the drugs commonly prescribed for osteoporosis, but without the nasty side effects. The research also suggests that vitamin K2 may lower the risk of heart disease by preventing arterial calcification, meaning it could keep your arteries flexible and reduce the risk of heart attacks and strokes. So where do you find K2? It's in fermented foods like natto, aged cheeses, and certain meats. But here's the catch. Most people aren't eating enough of these, which is why supplementation is being explored as a potential strategy for heart and bone health. Vitamin D3, or cholecalciferol, has been in the spotlight for years, and for good reason. It plays a major role in calcium absorption, immune function, muscle health, and even metabolic processes. However, research has shown that many people, especially those with darker skin tones, those living in colder climates, or individuals with higher body fat percentages, don't get enough vitamin D3. And here's a kicker. If you have a higher BMI, your body doesn't absorb vitamin D3 as well, which means even if you're supplementing, you might not be getting the full benefit. A study found that taking 25-hydroxyvitamin D3, a more bioavailable form, instead of regular vitamin D3, could be a more effective way to raise blood levels, especially for those with obesity or intestinal malabsorption conditions. One of the most exciting areas of research in recent years has been vitamin D3's potential role in severe COVID-19 outcomes and recovery. A meta-analysis of 13 clinical trials found that vitamin D3 supplementation reduced ICU admissions by 27% and COVID-related deaths by 44%. Why is this happening? Well, vitamin D plays a crucial role in immune regulation, reducing inflammation, and improving the body's ability to fight viral infections. When COVID-19 gets severe, it's often due to an overreaction of the immune system known as a cytokine storm, where excessive inflammation damages the lungs and other organs. Vitamin D3 may help keep this response in check. What about COVID-19 recovery? Newer research suggests that vitamin D3 may also play a role in post-COVID recovery, especially in reducing symptoms like fatigue, muscle weakness, and lingering inflammation. Some studies have even linked low vitamin D levels with a higher risk of developing long COVID. So, if you've had COVID-19 and you're still feeling sluggish, supplementing with vitamin D3, especially if your levels are low, might support a smoother recovery. Now here's where things get really interesting. Vitamin D3 and K2 are a powerhouse duo. Vitamin D3 increases calcium absorption in the gut. Vitamin K2 makes sure that calcium ends up in bones, not in arteries. Without enough K2, excess calcium could harden arteries instead of strengthening bones, not exactly what you want. This is why some experts argue that if you're taking high-dose vitamin D3, you should consider pairing it with K2 to avoid potential long-term cardiovascular risks. Beyond bone and heart health, there's emerging interest in how K2 may support COVID-19 recovery. Some researchers suggest that K2's anti-inflammatory properties could complement vitamin D3's immune benefits, especially in reducing post-viral complications. Let's be real. Most of us aren't eating natto, fermented soybeans, every day or spending hours soaking up sunshine. So, should you take a vitamin D3 and K2 supplement? If you have a higher BMI, live in a low sunlight area, or are older, you might benefit from a vitamin D3 supplement. If you're taking vitamin D3 regularly, consider adding a vitamin K2 supplement to support proper calcium metabolism. For those with malabsorption issues, like Crohn's or celiac disease, 25-hydroxyvitamin D3 may be a better alternative. If you're recovering from COVID-19 or at risk of long COVID, optimizing your vitamin D3 levels may support a faster recovery. Of course, before adding any supplements to your routine, talk to your doctor or healthcare provider to determine the right dosage for you. To wrap things up, vitamin D3 and K2 are far more than just bone vitamins. They impact everything from heart health to immune function, and research suggests they may even play a role in reducing severe disease outcomes and helping people recover from COVID-19. If you're not getting enough from diet or sunlight, smart supplementation could be a game changer. Just make sure you're using them together for maximum benefit. That's it for today's episode of MedHeads, brought to you by meducate.com.au, your hub for high-quality courses and content designed for health professionals. If you found this episode valuable, make sure to subscribe and share it with your colleagues. Until next time, stay curious, stay informed, and stay healthy.